officials continue to monitor the Hantavirus, a small but deadly outbreak from a cruise ship also linked to isolated cases around the world. Thanks for joining us tonight. I'm Rory Johnston. Health officials say there are now at least 11 confirmed or suspected cases, including 3 deaths. The strain involved, the Andes virus, is the only known form of hantavirus that can spread from person to person through prolonged close contact. It's typically diagnosed after exposure to contaminated rodent waste or saliva. 17 Americans and a British dual citizen who lives in the U.S. arrived back here in the States Monday. 15 went to a national quarantine unit in Nebraska, including a travel content creator who tested negative.
Feeling good today. It was a pretty relaxed day again. I started the day with a temperature check, and then I had a call with one of the doctors in the morning just about when the time comes, the process of how I'll get home.
One of those in quarantine tested mildly positive and was placed in a biocontainment unit. The question is, what does all this mean for us here at home? News Channel 5's Nikki Hauser spoke with a well-known local doctor about whether people in the mid-state should be concerned.
Well, this is unique, strange, unusual, and rare, but I knew right away, because it was so exotic, that there would be a great deal of attention devoted to it.
News of the hantavirus is spreading across the country, but experts say the risk of the virus itself spreading is minimal.
Relax, step back. Your risk is actually 0.
Dr. William Schaffner is an expert on infectious diseases at Vanderbilt University. He's been a leading public voice throughout the COVID-19 pandemic. He says while there may be some cases that follow the MV Hondias cruise ship outbreak, the hantavirus is not a major public threat.
It has a very different personality than influenza and COVID, which we know can spread very widely, very quickly. Not like it.
Those who may have been exposed either on the ship or inadvertently on planes with passengers who left early are being monitored by health organizations around the world.
So we've had a bunch of exposed passengers come to the United States. They're in 2 units, one at Emory University in Atlanta, the other one at Omaha in the University of Nebraska.
Our top priority is both the passengers who are on the ship and American communities.
In a press conference Thursday, CDC Incident Manager Dr. David Fitter says those with possible exposure are encouraged to stay quarantined for up to 6 weeks, although there's no state or federal quarantine orders in place.
This is a known virus, and we've seen this in the United States before, and we know how to respond to it. And that's what we're doing, and we're putting into action all of the things that we have in place to ensure that American communities remain safe and healthy.
While the hantavirus can be serious when someone is infected, experts assure it's not highly contagious.
I'll say it again. There will not be widespread virus transmission.
It sounds like people can more or less breathe a sigh of relief.
Oh, I think they can breathe a sigh of relief. We can expect a few more cases as all this plays out, but it's not going to take off or anything like that.
That's good news, a relief for a lot of people to hear that this is vastly different from COVID-19, right, Nikki?
Yeah, that's the good news. Yeah. And some other good news we talked about is he said don't freak out. If you love cruises, continue to go on them. I know Jimmy, our photographer, will be happy about that. Yeah. But just, practice personal hygiene. But it really wasn't about the cruise. It was a specific thing in this case.
Specific case.
Continue to have fun with that.
Use common sense, too.
Exactly.
All right. Thanks, Nikki.